Dr. Patrick Hannaway, welcome to Thyroid Strong Podcast. I am so excited to have you here. I watched so many of your lectures inside of Institute for Functional Medicine, and they were so approachable and digestible and so informative. So I wanted to bring you on to share with the listeners your wealth of knowledge.
Well, thank you so much. It's a great pleasure to be able to reach out to Thyroid Strong and your great following that you have.
The listeners of this podcast have Hashimoto's. And oftentimes, if they have only been maybe just diagnosed and then given medication, and then sometimes they're just sent on their way, they don't know that our gut health and the health and diversity of our microbiome inside our gut can play a role in Hashimoto's. Can you connect those two pieces? Because some women are like, oh, I just thought it was my thyroid. Why are we talking about my gut?
Right. Well, I might even bring it up a level from there because it's not just the microbiome, but it is the gut has such an essential role in what's going on. And I'm sure you're familiar with Dr. Alessio Fasano's work on looking at intestinal permeability. And what we find is that 12.5% of the population has Hashimoto's, something in that nature or something in that range, or at least has the predisposing factors for it and maybe have autoantibodies, but not yet have changes that are going on. Of course, there's the whole question about testing and diagnosis, but we're not going to go into that in depth because you've talked about that a number of times previously.
Yeah.
So the first thing is, okay, so this person has some kind of autoimmune disease. There are over 100 different types of autoimmune disease. Hashimoto's is actually the most common of all of them that's there. And while many people, including endocrinologists, think that it's just connected to the thyroid itself, it's actually a representation of an imbalance in the immune system that has systemic ramifications. Certainly, thyroid imbalances have systemic ramifications, but we also find that people who have an autoimmune disease, the number one risk factor of an autoimmune disease is having another autoimmune disease. So you're actually at increased risk for celiac disease and lupus and rheumatoid arthritis and Crohn's disease and many, many other kinds of things. So that's important, but that also tells us, there's something else going on here. And so when we start to look at what are common factors, one of the things that Dr. Fasano has highlighted through his discovery of the zonulin protein and working with intestinal permeability is that most autoimmune diseases, and we won't say every single one because there are a few exceptions, but most autoimmune diseases will have some degree of permeability in the gut lining. And that permeability where the molecules that are in the gut, whether it's foods, undigested foods, partially digested foods, bacteria, viruses, parasites, toxins, many different kinds of things that come into our gastrointestinal tract are moving through those open gates and stimulating the immune system, and the immune system is reacting. So we know, like with Hashimoto's thyroiditis, that there's a relationship with gluten. And not everybody who has Hashimoto's has issues with gluten, but certainly there are a number of people who will have autoantibodies to gluten and have difficulty, and that will have an impact. And whether it's due to some molecular mimicry at the thyroid peroxidase enzyme, the quote unquote TPO antibodies, we're not entirely clear on that. We see that there is a relationship that goes on. So we know that. So there's permeability. Now, one of the things that has an effect on permeability is the balance of, is there some inflammation or is there irritation or is there dysbiosis in the gut microbiome itself? So is there dysbiosis or imbalance? That term we use, dysbiosis, just means imbalance. And so think about it as there's a community in each of us. We have between 150 and 200 different bacterial families of organisms, species of organisms. Overall, there's trillions and trillions of organisms that are there, but they form a community. And in that community, they work and act together to be able to perform the functions. So I'm just going to go brief side note here.
Yeah.
Functions as in functional medicine. When we talk about functions, what we're talking about there are the functions of, do I assimilate and get what I need? Do I have a mechanism to get rid of that which I don't need? Do I have a mechanism for energy production, for communication, transportation, infrastructure, and defense and repair? Those are the functions. Those all have to happen even within the gut, within this community that is living there. One of my teachers at Washington University, when I was there, became the head of the Human Microbiome Project. And he has said that the human gut is the most complex ecosystem that has ever been discovered. And there are 8 billion of them on this planet, right? We're all different in that way. So you think, wow, there's a lot going on there. And the microbiome, if the functions aren't being performed properly, it will lead to permeability. It will lead to inflammation. It will lead to maldigestion. It will lead to immune dysregulation. It also will lead to changes in the products, the chemicals that are produced will change the way we feel. Anxiety, depression. So there's a lot going on there, and it has an impact directly on the thyroid as well. And so when we see Hashimoto's thyroiditis, we have to first think the gut and think about permeability and the microbiome. We can go into depth on any of those things. I said a whole bunch of stuff there.
Yeah. So you mentioned some of the things that can affect our microbiome, as well as the permeability of the gut lining.
Mm-hmm.
I think one of the things that women don't know is that certain medications can change the gut microbiome. Can you share, because I can't speak to medication as a chiropractor, but I would love to tap into your wealth of knowledge in terms of, okay, a lot of women think, oh, I'm just taking this medication for a certain condition, not knowing that it could potentially change our gut microbiome.
Well, I talked about the things that the microbiome changes will affect in the body. What changes the microbiome? Well, the first piece is going to be food. And I just have to note that. We'll come back to that. But the diversity of our foods, the number of different colors and types of vegetables and things we eat, will directly affect the diversity of our microbiome. And we want a diverse microbiome. Now, the diversity in my microbiome and yours are going to be different, but as long as the functions happen. And then there are a number of other things that if we eat foods that aren't organic and we get exposed to toxins, that will have an effect on the gut microbiome. If we eat foods or have medications that have particular additives in them, that will change the gut microbiome. We find that a number of medications will have gluten in them. We don't even know that, but you can Google it online. You say medications with gluten, and you can get medications that do not have gluten in them. Why would there be gluten in medications? But, a number of them are made with fillers or things that have various kinds of gluten or wheat-based components in them, but you can find ones that don't. Then of course, the anti-inflammatory medications, the NSAIDs, the non-steroidal anti-inflammatories, and whether we're talking about ibuprofen or acetaminophen or aspirin or naproxen or naproxen or long list, all are going to have a fundamental impact. They actually cause some degree of low-grade irritation in the gut. We know that, right? That's like, oh, you could get ulcers, you could get bleeding. They actually cause permeability, that permeability that we talked about earlier, and they cause changes in the gut microbiome. Things like steroids, of course, will have that kind of effect. Various hormones will have effects on shifting the distribution, composition, and distribution of the gut microbiome. So we've kind of gone through a number of different classes there now. The larger classes around antidepressants, anti-anxiety drugs, and statins, those are things that there appears to be a shift when they're given in the microbiome itself. Whether that shift is sufficient to actually lead to an inflammatory process or systemic effects, that part's unknown. The things I've talked about up to this point in time, those are clearly known and documented. But having awareness that there is going to be a shift the simplest way, frankly, to understand, well, am I doing okay? How do I tell if I'm doing okay or not? Is to just basically look at how many bowel movements are you having a day? One or two is the best answer to that. Any more, any less, generally going to be problematic in different ways. And are they formed? There's something called the Bristol stool scale. And it rates your poop from being runny to super hard, from 1 to 7. And you want to be at 4. You want to have it just be like a nice, as my friend Patch Adams used to talk about, a foot-long floater. You want a little gross, but you want to have a well-formed stool, and that's key. So anyway, I'm kind of jumping ahead,
Yeah.
but people would ask that question, well, how will I know if things are in balance or not? The thing is, 70% of Americans will have an imbalance will have dysbiosis in their guts. So it's a really high percentage.
That's a very high percentage. Do you think it's because of just some of the things that you mentioned that we're exposed to, or maybe shifts in our eating patterns? Because I know you do take like a food first approach. Like 70% is really high. Almost everyone should be working on their gut health, right? In some capacity.
Exactly. Well, I mean, that's one of the things when we were talking a little bit earlier. It's like when someone who I'm working with isn't doing well, they're not improving, I keep going back to those principles, food first and what's going on with the gut. Like I want to get that into balance first. And what I found in my practice, even early on, where I was really emphasizing the food, but then I was finding, oh, wow, these people actually aren't able to digest and assimilate the food. They had too much imbalance going on that I needed to work to be able to use what we commonly talk about as like a 5R program of remove what's not working and replace what you need support and rebalance the gut microbiome. And we can talk about that with these terms of prebiotics, probiotics, and postbiotics. And then working on being able to help to re-inoculate or repopulate, because you're not really inoculating, but repopulating the gut.
I want to ask you this question though. So I took this from your lecture and I love this, and I don't think many people know this. Changes in diet can cause large shifts in the microbiome in just 24 hours, which is profound because I think a lot of people think, and we'll touch upon this kind of like prebiotic, probiotic, and postbiotic, but I think a lot of people think, oh, it's going to be this long journey of like rebuilding gut health, but you could literally start to make large shifts in your microbiome within 24 hours. Like, how does that happen?
Yeah. So it's repair.
Repair. I knew you'd remember.
So we thought 20 years ago that there was a core microbiome that everyone had, and that it was just trying to help get people back to that. It's through the techniques of the more recent molecular techniques, which I could talk about at length, but nobody really cares. They just say, we figured out that there is a huge difference amongst all of us. And so we also found that when they were testing kids and adults and following people longitudinally with earlier kinds of approaches, they found that the gut microbiome was pretty similar if you keep eating the same foods. If you change your diet, you can actually change it. Dr. Mehmet Oz, most of us have heard of him. And he did a little experiment with using a smoothie. And he was able to begin showing changes in a day, in 24 hours, with very significant changes at their 3 days period of time. In 3 days, you could fundamentally change the gut microbiome. And we'd seen this in mice, but we hadn't actually seen it in adults. And it was like, oh, it'll take about a month for it. And he showed like, oh no, it actually starts happening in 24 hours and you're at a significant shift at 3 days period of time. And then there's some further studies that have gone on and used like a vegetarian diet group, that just a vegetarian diet, and then had a washout period, and then just a carnivorous diet where it was just like meat and cheese. And they could show shifts again in the microbiome within 24 hours period of time. So it kind of goes to what you eat, and what's in your gut is what you eat.
Do you know if in that study that you mentioned, if there was a difference in diversity? Because I know
there was a huge shift in diversity that happened at that point in time as well.
Yeah.
And so that's why I really emphasize the ability to, if you're going to use a smoothie, doing something that's got lots of different kinds of vegetables or sprouted vegetables in it as a way of being able to have a simple way to do it. If you're not looking at your plate, you should have 5 different colors of fruits and vegetables when you sit down to have at least your main meal. But the other thing that's interesting, and my friend Deanna Minnick kind of pointed this out and did this really fun online program about it. I think I have a diversity of fruits and vegetables in my diet, and I look down and I see lots of different colors. But she said, how many different vegetables do you eat in a week period of time? I can go through. It's like, okay, so kale, cauliflower, broccoli, mushrooms, basil, and avocados. I can go through, but there's about 12 to 15 things that I eat all the time. And then I started looking at, because she said, you should try to have 30 different kinds of vegetables every week. 30. And all of a sudden you're like, wow, I got to go shop at the Chinese market. I got to get some things I haven't tried before. I got to learn how to cook them. I got to be more diverse. I got to bring other things in. And she did an online thing of how many different vegetables could people eat. And my recollection is that the winner was a woman and her 12-year-old daughter who was really compelled. And they had 149 different vegetables that they ate in a week period of time. That's pretty impressive.
That's impressive. Yeah. I didn't even know there was like 149 in season at one time. I want to speak to, a lot of people know about a probiotic, right? That's kind of like general public knows. Not a lot of the general public knows about prebiotics or postbiotics and why they are important for our gut microbiome.
Let's first talk about probiotics, because probiotics, we know we take them. These are bacteria that are created to be similar to what's in our gut and to help bring balance back to the system. But what we found is that the probiotics act as tourists. They move through, they cause changes in the economy. I live in Asheville, North Carolina, which has become a great tourist place. Again, it's kind of like the town I moved to 27 years ago is fundamentally changed because there's so many tourists. And it's like you over rely on tourists. You don't want that. Probiotics can be very useful, just like antibiotics, when they're targeted, a specific probiotic and even a strain at a specific dosage for a specific period of time for a specific condition. So that's great. Now, a lot of people are saying, oh, I take probiotics to help my overall health and well-being. That's not actually ever been demonstrated. What we find is that the probiotics, even if someone is using a nice, well-balanced probiotic formulation with multiple different components, you should shift it up every 6 months if you're going to do that. Now, what's more important are the prebiotics. The prebiotics are going to be the foods that feed your bacteria in your gut to bring them back into balance. And so there are prebiotics, things like inulin and fructooligosaccharides. I particularly like acacia root. You can use potato starch as an agent. Those are both relatively inexpensive and easily accessible as powders. And then there's some other fancier names, xylo-oligosaccharides and arabinolactans and things like that. But the prebiotics are helping the beneficial bacteria to grow. And then what you also want to bring with that is you want to bring in what are the foods that are going to help direct the populations, the right populations to grow. And interestingly enough, the data shows us that the best foods to eat are berries. And the berries that have a red and black skin on them are going to be the best. Red, black, or blue. And so it's cranberries, blueberries, raspberries, black raspberries, pomegranate, cherries, all of those. And it's in the skin, actually, that has the flavonoids that help the beneficial bacteria to grow. So people will say, gosh, I've heard of this thing called Akkermansia. And there's a product out there. Akkermansia has been associated with decreased inflammation. But there's lots of different bacteria that will have an anti-inflammatory quality to them. And so just taking the one thing is a probiotic, and it's a tourist that goes on. But if you take a combination of something like acacia root with blueberries and blackberries and pomegranate, you actually grow Akkermansia. And you can do that for like $15 a month and eat berries, as opposed to taking a probiotic that may cost $100 a month. And has not been shown that when you take the Akkermansia, as soon as you stop, you don't have Akkermansia anymore. It's only good while it's there. Whereas if you're eating the foods, you will continue to help it to grow. So it's an example. So there's prebiotics where my emphasis is now. Probiotics are when there's a true imbalance. If there was a probiotic for Hashimoto's thyroiditis, I would tell you immediately. I'd say this dose, there's no data there. There are things for irritable bowel syndrome, especially when that aspect that's mixed in nature. There are probiotics for inflammatory bowel disease. There are probiotics for interstitial cystitis and urinary tract infections. These have been studied and we can dial that in. But for Hashimoto's or for other autoimmune diseases, we do not have that yet. We may find some that really act as specific agents, but we don't yet. So then we go to, well, what's this other term that you said? I've never heard that before. Postbiotics. What does that mean? Recall that I said we want to have the functions of the gut to be working all in balance with each other. And I talked about those 7 functions. The way in which that happens, the diversity of many different people's balanced gut microbiome, whether it's a microbiome in Singapore or in Paris or in Sao Paulo, there's diversity and balance. And we can tell there's balance because the functions are working properly. And the functions happen through the production of postbiotics. It's what the bacteria make. And we now begin to see that those things can affect the mitochondria and energy production. Those things can affect the balance of the immune system. Those postbiotics can affect the gut-brain axis and lead to changes in feelings of depression or anxiety or improvement of those kinds of things. So it's the postbiotics, which is probably where you've heard, some of your people have heard about fecal transplants. And that it's probably through the postbiotics that the fecal transplants are having their beneficial effect on the person overall of bringing them back into balance. So there's a lot going on in the conversation.
Yeah. Fecal transplant is not the first step or the first probably 20 steps. For people who I know who have gotten a fecal transplant, it's usually like the last resort. And from what I understand, not always successful.
No, and where you get it from, and there are people who are do-it-yourself, where they get it, where they get it from someone that they know and they create it themselves. It's not actually legal in the United States to do a fecal transplant at this point in time. There are some new postbiotic formulations that come from basically fecal transplants where all the bacteria have been killed. And so it creates a postbiotic. But you want to get it from a healthy cohort, a healthy group of people. So I want to share just a brief story where a colleague of mine, Dr. Tom Sult, and I were talking in 2008, 9, 10 about starting a program with fecal transplants for people. And I had gone to Australia and learned how to do it from Dr. Ted Barati, who's the most well-known person in this area. And then I was talking to a colleague at the group in Cork, Ireland, who are some of the best GI doctors in terms of the microbiome in the world. And Dr. Fergus Shanahan said to me, Patrick, you understand that changes in the gut microbiome can have an effect on, of course, Clostridium difficile, but also on heart disease, on cognition and Alzheimer's, on liver disease, on osteoporosis, on inflammatory bowel disease, on mood disorders of anxiety and depression. I'm like, yeah. And he said, so if you're taking a fecal transplant from someone and you don't understand what it's going to do, you give it to them, and that person who wasn't necessarily on a track for developing some cognitive problems or some behavioral problems or heart disease ends up moving in that direction, and we just don't know. Do you want to do that? Do you want to take on that risk? Certainly, if you have someone who's got this infection called C. difficile that it's approved for, these people are really sick and you can die from it. And so you need to do something, and it's 98% effective. So it makes sense in that setting. But if you've got someone with with irritable bowel syndrome or Hashimoto's thyroiditis or depression, and they think that they're going to get benefit from a fecal transplant, well, they may in that domain, but they may develop some other kinds of problems. And there are ways that we can work to heal the lining of the gut through focusing on the diversity of the microbiome, repairing the permeability damages that are going on, replacing the digestive enzymes and things that are missing, removing the foods in general that are going to be processed foods. I mean, that's job one. Get rid of the processed foods and then moving towards balance in that way. And that doesn't have any risk associated with it of long-term problems caused by the treatment.
Yeah. I had a friend get a fecal transplant, and a month later, she had her appendix burst. She got surgery, and I was like, oh, that's like a weird correlation. And then she needed a bunch of antibiotics after getting a fecal transplant, which was
Right.
kind of a bummer.
Right. And so, I mean, there are ways, there are some clinics in the UK, in the Bahamas, that have done these and that use a very healthy cohort of people who are eating organic and they're young and they're healthy and they've been qualified and they don't have any kinds of parasites or imbalances. And I think that's a reasonable way to do that. But even in the patients I've had who have gone to have that done, it's about 50% of them get significantly better and 50% don't. And it's a pretty big ask. Now, I had one patient who did a fecal transplant from her husband, and she got improvement, but she continued to have problems. She started taking this postbiotic kind of blend, and she got really significant improvement from it. So I believe that there's ways that we can work with the concept without actually doing a full fecal transplant. And then there's poop pills that are coming out now. One was just approved by the FDA last week, and it's not really poop. It's basically a combination of bacteria that have been derived and have been demonstrated to help with C. diff, this Clostridium difficile, this bad infection. But that's just where the data is on that. There's some fascinating research on fecal transplant with autoimmune disease, with autism, with mood disorders, with liver disease. There's some really cool stuff. So we know that changing the microbiome will change the overall physiology of what's going on for people. It's just there's ways to do it with food that are much simpler and easier.
In terms of the 5 R's, the first one is remove.
Right.
And it's not only maybe removing certain foods for potentially a period of time, but then also addressing underlying infections or maybe bacterial overgrowth or fungal overgrowth that could be happening in the gut. How does someone who maybe has just kind of gone like, okay, I have medication for my thyroid, how can I even start to discover maybe I have a gut infection? What would it be, working with someone and taking a thorough history? Would it be doing a stool sample? I know there's a lot of different labs that do different stool tests to start to kind of like walk that path of, okay, now we first is remove.
So in the remove stage, I'm taking the history to find out, when did this begin? And if it's something that occurred after doses of antibiotics, or something that occurred after travel, or something that had more of like a real defined point source, it's like, oh,
Yeah.
this day, this is when it happened, then I for sure go and want to do a stool test to be able to say, is it possibly an infection that's going on there? And these kinds of stool tests, the ones that are more comprehensive, are not the ones done through Quest and LabCorp, but done through other specialty laboratories like the one that I used to be the chief medical officer at. And in that process, they're going to look for parasites. They're going to look for worms. They're going to look for various kinds of potentially pathogenic bacteria that are there. They're going to look for an overgrowth of yeast or fungus to be able to see what's going on. And they're also going to assess, well, what kinds of antibacterias or antimicrobial herbs are these things sensitive to? And so you can measure certain aspects of the immune system that will say something called immunoglobulin, that when it's really high, it's like there's something going on that the immune system is saying, hey, I'm feeling attacked and I need to go after this. So there's ways to be able to look at that testing to say, yeah, there's something that needs to be done in terms of an infection that needs to be brought back into balance. And while we can use foods and things like that, if you've got the irritant continuing to be there, it's hard to get back into balance. And so, yeah, it's removing foods. And like in the case of Hashimoto's thyroiditis, for sure, removing gluten and removing processed foods and doing that. And something like a Whole30 diet, a food plan is a great kind of off-the-shelf food plan that you can gain access to. So that's the remove part of it.
Yeah. You mentioned earlier this gut-brain axis, and I want to bring this up because a lot of women with Hashimoto's will struggle with depression, anxiety, and then also brain fog.
Mhm.
And maybe we'll kind of go the route of, oh, well, maybe I should go to therapy, or maybe I should work out more to try and boost my endorphins. And they don't know that there is this connection of the gut to the brain. And maybe they should tap into that.
Yeah, there's a whole field that was developed by Dinan and Cryer in Cork, Ireland, called psychobiotics, where they've been looking deeply at this area. It's still in its infancy in terms of, is there a clear organism that's going to be really helpful? And the one I favor at this point in time is something called Zen Biome. It's made by Microbiome Labs. I don't have any affiliation with them, but the specific organism that's in there has been shown to be really quite helpful for dealing with depression, anxiety, kind of neuro imbalances in the gut-brain axis. And people say, well, really? Like, how does that happen? Does the poop go into your brain? No. There's pathways both through the nerves as well as through the blood, where sometimes people may not know, but 95% of the serotonin in your body, you've heard of serotonin, your audience has heard of serotonin, because it's like, this is what many of these antidepressant drugs are based upon. They're reuptake inhibitors. You don't have enough serotonin, but 95% of it's produced in the gut. It moves up into the brain. There are also other kinds of neurotransmitters. There are anti-inflammatories and pro-inflammatory agents that can move up. They can move through the blood, they can move through the vagus nerve, and they actually aggregate in a certain area called the insular cortex. Now, I won't get too detailed. I told you I wouldn't, but I love this stuff. It's like what our gut feelings are actually, they're our gut feelings. They're like what's happening in our gut is having an effect on how we feel, and it's that direct. So yeah, there are agents now that we're beginning to learn can have an effect. Now, here I'm back on probiotics. You can say, wait, he said before he doesn't focus on probiotics. But if I'm working on a specific problem, a specific issue that's there, then I'm going to use that as an agent for a specific period of time at a specific dose to try to affect change, knowing that my goal all along is to change the diet and to change to the relationship to stress. I'm going to kind of go off topic for a moment here. But there's data now. So the vagus nerve, when you're training, you know a lot about the vagus nerve, but the vagus nerve is not like Las Vegas. It's VAGUS, and it's the wandering nerve. And the wandering nerve that comes down the back of our throat, and it affects our production of digestive enzymes. It affects our stomach. It affects motility. It affects our breathing. It affects our heart rate. It affects the rate of motility of the gut. And there are different branches of the vagus nerve. They go front and back, anterior and dorsal, and different effects that go on. One of the things that I've been learning recently, and I've been interested in the vagus nerve for a long time, but I've found that if your vagus nerve isn't working properly because you're overly stressed, you're in fight or flight response instead of in more of a chill parasympathetic tone. So you have parasympathetic, chill, sympathetic, right, freeze, appease. And If you're in that zone, then your vagus nerve isn't working very well. You're not actually going to be able to digest your food properly. You're not necessarily going to have even the supplements you're taking be able to be incorporated effectively in what's going on. And the vagus nerve is used as also a conduit, both to the brain and back from the brain about what's happening in the microbiome. It's a loop system that is giving feedback to what's happening in your gut, is affecting your feelings, is affecting your overall habituated behaviors of fight or flight or freeze, appease. So how do we get into a deeper tone, a deeper balance point? And I want to say one more thing about that, because it's typical things like yoga, slow down, take a walk, be in nature, say prayers, meditate, knit. All these things help. Sitting in front of a TV and watching a movie, that's not going to help. It's got to be active. And then there's now external vagal nerve stimulators that actually can help with that as well. Then one would say, well, I'm pretty chill. I mean, my friends say I'm a pretty chill guy, so I must not have a problem. I really like measuring heart rate variability. So heart rate variability is a way to be able to say, where am I? Because when we're young, in our teens and early 20s, our heart rate has a variability. It doesn't just go dump, dump, dump like a metronome. There's a little bit of variation. So when we're young, that variation is as much of 100 milliseconds, a tenth of a second variation. And that's telling us that we've got really good vagal tone. We've got really good balance between our parasympathetic and sympathetic nervous system. Now, when you get to be in your 60s, like I am, with aging, the normal, that rate, we become less flexible, more restricted, and that beat-to-beat variation is between 10 and 20 milliseconds. It's like 90% less. But you can measure it. You can measure it using a tool like this Oura ring that I have on my hand right here, on my finger. You can use it by measuring other kinds of tools. There's even new tools that are going to be coming out that will be able to use the camera from your cell phone to look at you and tell you what your heart rate variability is. So it's an important thing to understand. And where am I? And what will help me? Maybe heard some of my own journeys, but I found that being in nature actually made the biggest shift for me to be able to do that. And so that's what works best for me. The other things are helpful, but finding out what works best so that it decreases intestinal permeability. It changes the gut microbiome. So between stress and food, those are your two biggest things that you can.
So because you always hear like, oh, trust your gut. What does your gut say? And I'm like, well, I might have gut dysbiosis. I don't know what my gut says. My intuition might be off.
Yeah. And you can actually measure what's going on. There's stool testing that will help to be able to see, is it in balance or is it out of balance? And one of the things I'm going to talk clinically for a moment, one of the things I've learned is that what I want to do with the people who come to see me is I want to get them on a better diet right away. I want to get them off of processed foods, and I want to help them. Usually I stop gluten at least for a trial and then add it back. And so it's a 4 or 6 week process. Then I say, if they're still not feeling well, then I test the gut, because I already know the main drivers are going to be there. So let's see if things are in balance. Are you in balance? If your food and nutrients and things are moving in a good way. And then
I think a lot of women like to default to food sensitivity testing to kind of determine what they should eat and what they shouldn't eat. And I think it's not the right approach. Can you share why? Because I get a lot of messages like, what food sensitivity testing? And I was like, maybe none. Maybe there's a better way.
Well, I think I'm a little controversial in this area. And as I said, I worked for a lab that did this kind of testing, and so I'm really familiar with it, but I was never supportive of it, because what happens is that if you have permeability, you will have reactivity to the foods that you're eating. And if you switch the foods that you're eating, and you have permeability, now you'll have a reaction to the new foods that you're eating.
Yeah.
So there are some aspects where some people are uniquely responsive and or reactive to specific food groups, whether it's corn, dairy, or beef, or gluten. But that's why I work with a food challenge, an elimination diet, to remove those things initially and then start adding back after 3 to 4 weeks period of time and see how do I feel. Because there's no validation of IgG food testing. Now, here I'm not talking about allergy testing because that's important, and the IgE food allergy testing can be really useful if you have a specific thing that you're reacting to. But the IgG testing, it's just not reproducible across labs or over time because it's more of a reflection of permeability. And the other big thing, and I'm sure you've seen this in practice, I see people walking around carrying cards and things and saying, oh, I can't eat all these. I have this test. I can't eat all these foods. And it's developed something that the term that has emerged is orthorexia nervosa.
Yeah.
And that is why my immunology friends and rheumatology friends really don't speak strongly against this kind of testing, because it gives a false notion and it limits the diversity of foods that people eat. Not a good thing.
Which then in turn limits potentially the diversity in our gut microbiome, right?
Exactly.
Yeah.
Exactly. And we see this with people who are eating like a SIBO low FODMAPs diet also. I mean, if people have small intestinal bacterial overgrowth, yes, it's a real thing. Yes, there's bloating there. Yes, eating a diet that does not contain a lot of these, what are called FODMAPs, fructooligodiamonosaccharides and polyols. You don't have to remember that. But they come from lots of vegetables. Well, it's useful in the short term to help be able to gain some balance back, but it's not useful in the long term. But I see a lot of people who stay on that diet, and it's not a good long-term diet.
For people who do introduce an increase in vegetables and a diversity, and they might have some bloating or maybe indigestion, what do you recommend for those people? Because if they're like, I want to take a food first approach, and then they start to, maybe it doesn't sit well with them at first.
There's a couple different things. One of them is like with a lot of the prebiotics that I mentioned, if you actually don't have a balance in your gut and you take a prebiotic like inulin or fructooligosaccharides, FOS, they call it, that's going to cause more of a non-specific growth of everything. And if you're out of balance, you're going to kind of accentuate that. So starting slow with it and going with a low dose of a prebiotic, and then beginning to look at it, journaling, like, well, what foods do I notice are a problem? And they tend to fall in categories. So sometimes it's more like the allicins, like the garlic and the onions and the shallots and things of that nature. For other people, it may be more of the nightshades that cause imbalances. And so work to say, how do I begin to parse this out by the foods that I'm eating? And the other thing is that when you change your diet, it is totally expected that you're going to have some shifts in the gut in the first week period of time. And you want to kind of move through 7 to 10 days to say, well, where am I at now? Now, if you're still having bloating and problems at that point in time, then you got to do what I just said. Start to look at which food is it. But give it 7 to 10 days on the front end, because that's when the shifts are occurring and you're trying to find what the new balance is to be able to do that. And as I said earlier, and as you work with those things, if after a 4 to 6 week period of time, you're still having significant issues, that's a time to be able to do testing.
Such a great mindset shift, right? Because I think some people think, oh, I've been doing this for 2 days. Oh, why isn't my bloating better? So I think that's a great reframe. Dr. Hannaway, thank you so much for all the information you shared. Where can people find you and where can people work with you?
Well, I'm laughing because I'm not taking new patients at this time. My career is focused on being able to educate providers through the Institute for Functional Medicine at this point in time. And it's a passion to teach, and I love to do it. So where I encourage people to go is ifm.org/find a practitioner, or if you just go to the main page, the upper right-hand side, there's a find a practitioner. And these are people who have been through the training. If you find someone who's an IFM certified practitioner, they've gone through, they've been tested, they understand what's going on, and you can search by your zip code or by your state and set a distance area. We've got thousands of practitioners who are trained now and tens of thousands of practitioners who have begun to learn the process that's occurring. So I feel really pleased that we have been able to do training, get people into your neighborhood.
And I send people to that link all the time because I have women are like, where do I find someone in North Dakota? And I'm like, well, go to IFM,
Yeah.
check for practitioners. Yeah.
Yeah.
Well, thank you so much. I have taken a bunch of notes and I'm sure the listeners have as well. So thank you for sharing your wealth of knowledge. And I really loved our conversation and thank you for being on.
Oh, you bet. Thank you so much. And thank you for the work that you're doing to empower women and help them to recognize that when we're out of balance, it's just a call to be able to help find what's going on in my life and how do I move back into balance. And then you're sharing that and helping people to be on that journey of healing to become whole. I really appreciate it.
Yeah. Thank you.